Okay, next case. Another older woman, 75-year-old woman, history of digestive complaints, burning sensation from mouth to anus, and flank pain. Okay, immediately highly suspicious for Sjogren's. Burning sensation alleviated with antimicrobial protocol, pre and probiotics, digestive enzymes. Interesting. Flank pain diagnosed as gallbladder stones or sludge with recommendations for surgery. She does not want surgery. I prescribed Dissolve GS and Herbal A&G for her pain. She started taking a TUDCA product that she found online and started passing lots of stones. Great. The picture she sent me showed some stones that looked pretty big. Maybe they came from the liver because the CT only showed sludge in the gallbladder. I became concerned that she was moving the stones too fast and might get into trouble, so I recommended focusing on the Dissolve GS while taking the TUDCA. Her flank pain improved significantly, came back somewhat when she discontinued it. I would like your feedback on approaches to help people avoid surgery. Okay, excellent job. Yes, okay, this case study points out an important piece. The Dissolve GS is a great product for stones. Now, there's a couple of pieces in here. One, stones don't always show up in the ultrasound if they're not calcified enough. So you can have stones in the gallbladder and or the liver, not see them on scan, and they're there. If they're coming out and they're big, it's fine. The problem here is, it sounded like maybe her flank pain wasn't getting better or was even getting worse. And that's what you have to watch for when you're moving out stones. If you're getting an increase in pain or you're getting like a gallbladder attack or an abdominal pain attack, you might be moving them too quickly. So that is important. So sometimes backing off can be good. I definitely use TUDCA in detox protocols, and Dissolve GS is great. Yeah, so excellent. That's a great approach as like a basic. Also, just so then adding in a little bit more push by adding bitters and adding in a binder, Cellcore biotoxin binder would be a great idea because you're not just moving stones, you're also moving toxins. So these things are pushing everything through the liver gallbladder. So you need to catch some of these toxins. That's going to take some of the burden off of the liver in this process. You might want to also add glutathione to help the liver go a little smoother here. Generally, this is a patient that I would want to do a full detox protocol with, right? Because stones don't come from nowhere. Stones come from a long time of stagnation, right? So we know everything has been backed up for a long time by the time we get to stones. So I'm going to want to dig back through that stagnation by going through a full detox. So I would come to the detox class where we go into detail, but you can do the basic things that I outlined in this class as a starting point for that. But generally, it sounds like you're approaching it really well. And Western medicine doesn't have a treatment for stones other than waiting for them to disappear on their own or taking out the gallbladder. And the danger is if they block the common bile duct that's an emergency. That's an emergency surgery. So we don't want that. The great thing about the Dissolve GS is that it's breaking them down, not just moving them. So it has both elements. So it's helping to break them apart. And so they're less likely to be blocking, right? So it sounds like you're managing it pretty well, but we'll get into that in the detox class in detail.